welcome everybody to the Mental Health and IBD Roundtable. Sorry we're a little late. We had a skosh of technical difficulties. But if you don't know me, my name is Jackie Zimmerman. I was diagnosed with colitis in 2009 and completed the process to get a J-pouch in 2011. I've been talking lovingly about my butt disease since the beginning of that process. And through that process, I saw a gap in the support specifically for women in IBD. So I started Girls with Guts to help my fellow IBD patients out. More recently, I have been focusing on supporting people living with mental illness and who are struggling with mental health. I have a podcast called Not Crazy. Check it out. But what we are here to do today is talk about mental health and IBD. At the end of last year, I was chatting with our friends at Gali Health about the strong connection between depression and anxiety and people living with IBD, and how when I was first diagnosed many moons ago, that wasn't something a lot of doctors talked about. Nobody warned me, told me signs to look for. And in the last couple years, I feel like the push to recognize the mind-body connection among IBD patients has gotten a lot stronger. There are more patients talking about it, sharing their struggles with mental health, and we decided that we really wanted to talk about it with some other fantastic advocates. So we are here tonight to do that. We've also left some Q&A time at the end of this chat. So if you have any questions, throw those in the comments and we will get to them in a little while. But it's time to get this party started. So I know some of you on this call. I don't know everybody, and our viewers might have no idea who we are at all. So I want to go around and introduce each one of you. Well, I'm going to ask you to introduce yourself and share a little bit about your IBD history. So how long have you been diagnosed? Have you had surgery? How you're doing today? Just give us a rundown. Let's start with you, Mary.
Hi, I'm Mary with It Could Be Worse blog. I started having symptoms in 2014, and it took me 2 years for a diagnosis of small bowel Crohn's disease. After that, I just kind of started sharing my blog, It Could Be Worse, and telling my story and my patient perspective. I have had 3 Crohn's related surgeries, as I have perianal disease as well, with 2 abscesses and a fistulotomy. And I guess that's all I have to say.
Mary, what made you decide to be an advocate?
Well, I've always liked writing, and I have my degree in communication and journalism, and I thought what better way to get rid of all the anxiety and like stuff I'm dealing with than vent it and just get it out into the world and find other people who suffer like I do.
Same, girl, same. Angela, what about you?
Hi, my name is Angela. I was diagnosed in 2010 by an emergency surgery after being turned away and told I was too young to have anything wrong with me. And then I was told that I couldn't have Crohn's, could have Asian, all of which not true. And so I've had multiple surgeries since then, and I'm just changed medications again. And I don't qualify for the trial for Xeljanz, but that is my next go-to, the last one. And so I just started looking for support online and finding more information, and I ran into some great people, and I share my story so others don't feel alone.
Thanks for sharing that. How about you, Joe?
Yeah, am I unmuted? Good. I'm Joe Hinksman. I have kind of like a micro blog going on Instagram. You look fine to me. And I was diagnosed with Crohn's disease in 2016, so a relatively new diagnosis. Yeah, I just wasn't feeling too hot. Had some pains going on, and they figured it was appendectomy. So I went in to get my appendix removed, and surgeon kind of went, whoa, and found out that I had pretty severe Crohn's disease affecting most of my ileum. So following that, I did a cycle of drugs and was off work, and that was a huge struggle. And then I started doing Remicade, which is a biologic therapy, and that woke up a gene for pustular psoriasis, which affected my hands and my feet so bad that there was a period of like 7 or 8 months where I could hardly walk. And so, dealing with that as well as the Crohn's disease was definitely an uphill battle. Then in December 2018, I had bowel resection surgery. And then shortly after the surgery, my Crohn's disease just relapsed in the same spot that they took it out. So we've kind of just been managing it and doing cycles of prednisone through flares and just trying to calm it down and kind of moving in the direction of hopefully not having to just repeat that surgery. So I've been able to, avoid any type of ileostomy bag or anything like that so far, but definitely a relapse remission relationship with my Crohn's disease and extra intestinal symptoms. I get inflammation all over the place, joints and costochondritis in my chest and all that lovely stuff. So I just started sharing my story on Instagram just to connect with people. And then I discovered a whole bunch of community, made a bunch of connections. Everything started, just growing from there. And now, I like connecting and supporting people who, just like what was said, who suffer through kind of the same stuff I do. And that's about it.
Yeah. And now your Instagram is like huge. You have like 10,000 followers or something now.
Yeah. And I actually feel a little bit remorseful because I've been neglecting it lately. But there's a huge community out there of people who love to relate, right? Empathy is one of the best therapies there is, right? So connecting with people who kind of know what you're going through is really therapeutic. So that Instagram account's been a really cathartic experience. And actually this year I plan on kind of kicking back into it and posting some more content and doing some more writing. So it will be revived.
I totally agree. That's why I started blogging in the beginning too, was for me, it was a catharsis to like get it all out. And I was shocked that other people liked reading about my butt. Like who knew, right? So what about you, Sarah?
Hey guys, my name's Sarah. I am chronically Sarah, you see on Instagram. I have ulcerative colitis. I was diagnosed in 2014. I was 24, relatively healthy before then. I struggled with high dose prednisone, all sorts of biologics at double doses, immunomodulators. Nothing worked. So I finally decided I wasn't going to do Xeljanz. I was going to do a permanent ileostomy. And that was completed in 2018. I feel better now. I don't necessarily feel great. So I like to advocate for ulcerative colitis not being cured just because you have a colectomy. But I also like to talk about sort of uncomfortable and stigmatized subjects such as medical cannabis, healthcare as a human right, and also just mental health issues and inflammatory bowel disease. So I'm really glad that we're having this discussion tonight because my mental health has decreased significantly since my diagnosis, and I know I'm not alone. And in fact, I don't really know anyone with severe disease that has stellar mental health. So I hope that we can really get the word out that it's okay to not always feel okay and you're not alone. So I'm hoping we can accomplish that.
Well, and you have a really interesting background too. Can you share a little bit about that?
Sure. So I was a addictions therapist. I was also co-occurring with mental health disorders. I got accepted into a master's of social work program, one of the most prestigious in the nation, but unfortunately I couldn't afford it. And then I got sick right after. So I was able to continue on with addictions and mental health therapy. I tried until 2016, and my ulcerative colitis wouldn't allow me to stay in rooms with my patients, and I unfortunately had to let it go. So I'm very passionate about this subject. I am educated in how to handle PTSD and IBD, or bipolar disorder and IBD. And so I want people to know that if you have those co-occurring disorders, meaning mental health and physical health, you're definitely not alone. And so I hope that we can really, 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 really help people.
Thank you for sharing that. I am super excited to see your opinions on some of the questions that I'm going to throw at you guys later tonight. And our last wonderful advocate, a friend of mine, Shawn.
Hey guys. So I was diagnosed with ulcerative colitis at the end of 2009. So I just had my 10-year IBD anniversary. And unfortunately, last year I was diagnosed with, my diagnosis changed to Crohn's disease. So that's fun. I had quite a few issues that we all can understand, but I won't get into tonight. But I did end up having 3 J pouch surgeries and quite a few other surgeries just for the extra intestinal manifestations. And yeah, I mean, I finally, after all of that, I've found a biologic that works for me, and a little tired, but other than that, I feel good.
And you've also managed to do a lot of traveling too, right? Which I feel like is a conversation for another day, but traveling with IBD is like a pretty impressive deal, and like international travel.
Yeah, it is. I agree. It's been a journey, definitely, but I've learned a lot. It's taught me a lot, and it's helped me to appreciate where I am a little bit more, I think. I think some days I take it for granted, and just traveling and doing things I never imagined myself doing, it kind of reminds me of where I was.
Well, maybe we'll travel together someday. That's what I think. Okay, I'm ready to ask you guys so many good questions. I think they're good. I came up with them, so I definitely think they're good. But before we jump in, I have like a small disclaimer that I want to share with everybody listening, which is that we are not health professionals. Well, most of us. I think Sarah's maybe kind of a health professional, but for the most part, we're not experts. So that means that the focus of tonight's conversation is really about lived experience and sharing those lived experiences. So any of the conversations that we have tonight are about what we've gone through. And if you have any questions about specific treatments, those are really best directed to your doctor, not us. And I also want to put out a possible content warning for those of you listening at home tonight. We will be talking about mental health and mental illness, and the topic of suicide and suicidal ideations may come up. So if you need to talk to somebody about that, or you need resources to support you, we will have a few that you can find in the comment section. So let's dive in. The first question that I have, and I would like to direct this at Shawn, is prior to your IBD diagnosis, did you ever have any significant struggles with anxiety or depression or mental illness in general?
I was diagnosed with IBD pretty young, but I would say, not to get too deep or too off track, but because my mom has schizophrenia and I was dealing with that from a very young age, then I was always dealing with some type of anxiety, some type of form of depression. So, yeah, it definitely impacted me a lot.
Do you feel like I always say that before my mental health really kind of declined after IBD, that I just had like a touch of depression. Like I probably would have been diagnosed had I seen a mental health professional, but I didn't at that time because I didn't know that it was not common to feel that way. It wasn't until things got really bad after IBD that I was like, oh, this is not a normal way that people think about things.
Yeah, I think I started to realize that when I started, because when I was young, I wasn't very social. And then in high school, I started to get a little bit more social. I had more friends, and I would like go over to their houses and just seeing how their day to day was. I think that that's what made me realize that I was a little bit different, like just realizing that my health was different, my physical and mental health was different, my, family was different, my entire lifestyle was different.
I can only do you feel like because of the history with your mom that you were more attuned to it, or were you maybe neglecting it a little bit more?
I think as even being that young, being a caregiver, you just always, I mean, I'm not going to say you always, but you're more prone to neglecting your mental health because you're so focused on someone else.
I agree. I wanted to say something really profound, but I totally agree. Being a caregiver is really hard, and I think that most of us who I honestly would say have been fortunate enough not to be a caregiver, it's hard until you are one. You don't realize like how much different it is like on the other side of the bed. It's such a different experience.
Yeah.
Mary, you have an interesting background. If you would share some of that, and then also like, where were you with anxiety, depression, kind of before IBD?
I think I was kind of like Shawn said, it was kind of put on the back burner because, you're thinking about other things. I was a Navy veteran. I had a pretty rough upbringing. I didn't really bring it up to you in the emails, but, I had to deal with that as stress. I had shingles as a child. I was so stressed out just from my upbringing. You were in and out of homeless shelters and just constant something happening to where you don't think about yourself, and you're trying to like help your brother, help your family. And so it's just that gets put on the back burner. Like she said, if I would have seen somebody, they probably would have diagnosed me, like I would have been seen. But it wasn't until after my time in the military, and that's a stress of just its own. I also had a military sexual assault, and that causes stress in itself. After my diagnosis and realizing I was going to have to live with this forever, and trying medication after medication, I'm on my 8th now, and just realizing I got to live with this forever, like my mental health like really declined. People saw me as like bitter and scathing, and I was nasty. I was just mad at the world for something, I couldn't control. And I'm like, that's not healthy. Like, so you're trying to find a positive in it. And so I think that's why I use so much humor in my blog and try to be real about, my butt problems and stuff like that, and just kind of find humor in it and not be so angry and mad at the world, because it's nothing you can control. You know what I mean? Mm-hmm.
I always feel like if I didn't laugh at it, I'd cry all the time. So
Yeah.
I'd much rather just laugh and tell butt jokes, because otherwise it's way more fun to do that than to just be like crying all the time.
Yeah, pre-Crohn's, I've never once in public mentioned my butt, but now it's like a constant conversation of, just what's going on today.
Do you ever get people who are like, is it okay? I know this is weird if I ask you this question, but I'm like, this is literally half of my career is talking about my butt and other people's butts. So like, it's not that weird.
Yeah, like I know my sister, she can like message me with any kind of chaos that she has, because she knows like I've heard it or I've seen it or I've dealt with it. It's like, it's no biggie. Like we can talk about it.
Joe, you mentioned that you were kind of recently diagnosed last couple years or so. Were you having issues with mental illness or anxiety, depression before your diagnosis?
Yeah, for sure. I mean, I've had kind of anxiety and bouts of depression prior to my diagnosis, for sure. Like I had, for a long time, I've had some pretty significant things going on in my life that are far outside the spectrum of this conversation. But there was a lot of anxiety and stress, both self-created and in my environment. We had a pretty significant tragedy in the family 10 years ago, and that kind of is when things started spinning out of control for me. And if anyone checks out my Instagram, kind of there's a little bit more of my story on there. But yeah, I definitely struggled with anxiety and depression. I tried different medications even and stuff. I was diagnosed by my doctor to have like a bit of an anxiety disorder and that sort of stuff. So it's definitely been, kind of uninvited visitors in my life because of different circumstances, and then just lingering as well, right? So yeah, it's definitely been a part of my life. And when I was diagnosed with Crohn's disease, it was almost like a feeling of elation. It was, my mental health improved significantly after my diagnosis, at least for a period of time, because it gave me a lot of answers and grounded me into kind of reality. And so when I started learning how to be accountable and stuff, and that's what a lot of my writing is about, right?
I think a lot of patients have that like relief for them, especially in IBD. I hear all the time about people who doctors don't believe them, or tests come back clean and it doesn't show any disease activity or anything. And we have that like constant part of us that's something is wrong. I know it's wrong. The tests don't show that it's wrong. I think that alone builds anxiety. But then you add on the concern on top of that of like, okay, but if I'm wrong, am I crazy? Did I make this up? And so when you get that diagnosis, you're like, see, I know what I'm talking about. But then you're like, oh, this actually kind of sucks, even though I know that it's good that I know what's going on now.
Yeah, like it doesn't take long for that, like, haha, I knew something was up feeling to wear off. And then you're stuck going, okay, like, it's my responsibility to live with this and find ways to generate gratitude for the good things and feel good, but also deal with the debilitating issues and physical illness, right, at the same time. It's quite the juggle.
Agree. It's not particularly fun. And I don't think that that part necessarily gets easier. What do you think?
Yeah, I mean, it gets different, right? Like it definitely gets different and changes over time, but it's, you know, it's a chronic and progressive illness that requires chronic and progressive treatment, right? So things are always changing, and so it's a roller coaster ride, right? You're up and then you're down, and you're up and you're down, and you know, but at the end of the day, this illness has taught me so much that I think my life is moving in a better direction now, for sure, than it was before all this stuff happened.
I think I have so much to say back to that with like, yes, me too. Also, I'm a better person now. Like, look at all the cool things I've done. But like, again, another day. Um, but I think what you're saying about the up and down, the roller coaster part of this is, to me, that's one thing that nobody ever told me about. It wasn't like in my diagnosis, they were like, hey, just so you know, look out with this whole chronic thing. It's going to be pretty bad sometimes, and then you're going to be okay. And I feel like, you know, mental health and mental health maintenance was not discussed before or even after my diagnosis. Did you experience, like, did they talk to you about it, Joe?
Not really. It wasn't even really brought up, but I've always kind of been really candid. So I advocated for myself, and so I've always been pretty open about that kind of stuff. And the healthcare, like I'm over, and I don't know if I'm the only one in this chat in Canada, but the healthcare over here is kind of there if you need it, but you also get what you pay for, right? So if you don't advocate for yourself, you know, there's not too many questions asked, right? So no, I didn't really get pried into too much. I remember when I was in the hospital after my first surgery, I had one 1-hour session with like the hospital's version of a therapist, and that was it, right? So I'm very grateful that I have a family doctor who's more than willing to go to bat for me, right? And he's really good, and he has my back. So, you know, as long as I speak up, then I get the treatment I'm looking after, right?
I think at least you got that 1 hour. I don't even think I got that 1 hour.
Yeah.
Angela, for you, when you were diagnosed, did they give you any kind of heads up about potential issues with your mental health?
No, they really didn't at all. And I was actually told, oh, you're gonna have the surgery and then you're gonna be back up and going in no time. And I mean, there's no way to really tell the severity of someone's disease right away, I suppose. But then it was literally just, oh, just keep waiting. It'll get better and you're gonna go back to normal. You're just gonna go back to your normal life. Obviously, that's not what happened. And I did, once I switched GIs, I did see a mental health provider who then told me that I just needed to get back to work and I would feel better. And that also did not work because of the severity of the disease at the time. And so it took me a couple of people to actually get issues addressed. And I had untreated PTSD from something else, a different kind of trauma. And then, like, with my body acting the way it was, I just didn't feel safe at any point. And then it just kind of compounded, and it took me a long time to find someone that explained it well and said, you know, there's people out there that can help, and there's people out there that go through this as well. So I wasn't as isolated.
I feel like finding a therapist that specializes in chronic illness was like a massive game changer for me. Like because you're right, they'd be like, oh, well, you know, go back to work or try this or try that. It was never sort of like, how do you develop skills to cope with this thing that's going to be there forever? It was a lot of band-aids, it felt like.
Yeah, I totally agree, because I mean, and unfortunately, the person that was fantastic and did help me come to that realization and become more comfortable with it doesn't see patients on a regular basis that is actually needed. So I still haven't found one that has worked out, but I'll be honest, part of that's my fault. After a while, I got really frustrated because, you know, it's when you don't feel understood, it just kind of cycles through it. And then on top of that, just my physical health was also declining. And it was just like, well, this is too much, like right now. So although I probably shouldn't have, I kind of put it on the back burner for a while.
Finding a mental health provider in America, at least from my experience, it's never easy. It always takes there's hoops. It's not like, oh, just call them up and be like, hey, seeing new patients. It's referrals and waiting, and and then if you get to them and it's not a good match, you're starting over. It is anxiety inducing just to try to get an appointment with a doctor to treat your anxiety.
Yeah, definitely.
So I don't know if you guys know this, but I always thought that it was a fun fact that about 90% of your body's serotonin is made in the digestive tract. And I feel like no duh that we have issues with depression based on that. And given that, the fact that doctors don't ever talk to us or be like, hey, you should watch out for this. Why is that, Sarah? I know I'm putting you on the spot, but if it's like the no duh fact, right? We have science that shows us, hey, all this serotonin built here, and this part of your body has just diseased itself. Wouldn't it be like a no-brainer to tell patients like you should probably watch out for mental health issues?
I mean, I'm with you, girl. I'm kind of wondering why there's such a dichotomy between mental health and physical health. And you give physical health doctors that information that, X amount of your serotonin's in your large intestine, and then you have a colectomy patient and they can't figure out why there's mood swings. Then you bring in some prednisone, always tapering it. Maybe it needs to go back up. And you see this cycle, and I'm getting a little off track here, but I still to this day cannot figure out why there's two sides to that. And I really wish they did a better job of commingling the two. And I understand if physical health doctors really don't want to get into the mental health piece of it, but at least have the basics to know where to refer people and at least have those basic conversations, as opposed to just handing me a piece of paper that says, how often do you get outside? And it says, well, never. And maybe it's because I can't get out of the bathroom, and that causes the depression. And I don't understand why you don't understand that. I wish there was a better bridge between the two.
There has started being I want to say like a faction, which is not the right word, but there's a group of psychologists that are really focusing on GI psychology now. One of which I know Dr. Reel out of University of Michigan, who I love. And she is a psychologist that works in a GI office. Like that's all of her patients are GI patients. And they're starting to become more of this. And I, for one, am here for it. But I feel like it's been such a slow movement. Like, again, mind-body connection, we know that it's a thing. Why is it taking so long?
Why is it taking so long? There was a Crohn's and colitis Congress in Austin, Texas a few days ago, and there was big research that came out of it that IBD patients have poor mental health. And it's like, yeah, we didn't need, why did that take so long? I don't know why that takes so long. And for people to understand what life is like in the bathroom, to not be able to leave the house because you gotta be in the bathroom, because you can't work because you're in the bathroom, losing blood, you're on these drugs that are very expensive, and now you don't have your health insurance because you can't work because you're stuck in the bathroom. It boggles my mind that physical health doctors do not see the mental health problems within the population that they specialize in.
So we know that based on the science, it makes sense, right? Like there's serotonin in your gut is broken, everything is broken, right? But I have a question kind of for all of you. And do you think that it's a side effect of IBD to have like depression, anxiety due to physical science things? Or like is having IBD in general just super depressing?
Both.
I was going to say both.
Yeah, it's definitely both. Because having IBD in and of itself isn't super depressing. but missing out on the aspects of your life that IBD takes away from you can be super depressing. And I mean, you know, it doesn't matter how positive or how grateful somebody is, you can't generate, or I can't generate, you know, feeling good all the time. Reality usually sets in, and it's like you feel like I'm missing out sometimes, right? And then I obsess over becoming overproductive, and then the anxiety sets in because I'm like, oh well, I'm feeling good, I have to get everything done, I have to go out and live my life and do everything, and then I send myself into a flare because I go crazy, one extreme to another.
I feel like overdoing it because I could was basically like 5 years after my J pouch, where I was like, I'm alive, I can do things. Now I need to do all the things all the time, which was just like a terrible idea. But there's this part of you that feels like if I can, then I must, you know? Do all of you, just like quick show of hands, do all of you struggle with depression? Yay.
I do.
Yeah.
And like anxiety too, or is it like one or the other?
I have obsessive compulsive disorder and I have moderate depression.
Yeah, I have a healthy combination of both. It's sporadic though. Like I don't have constant depression, I don't have constant anxiety, but situationally it can be crippling.
I have a hard time since being sick, internalizing stress. I almost avoid it to the point of like it makes me sick. And like I'm sure a lot of us can agree that it's very hard, and I'll just avoid confrontation, or it's just because I don't know. Does anyone agree with me on that?
I do. I think if I don't have to stress about it, I just am like, well, you know, it's like you have your back burner and then the things you have to deal with. And I put a lot of those things on the back burner that I will deal with someday. And then I just don't deal with them because it's just one more thing that I can't handle.
I definitely put things on the back.
You go ahead.
I'm sorry, Joe. I definitely put things on the back burner that I probably shouldn't, truthfully. Like I, with my health, have not been doing great, but I absolutely refuse to go to an emergency room because of my last bad experience, and I just can't do it. So like going to the hospital at all, I like will always have headphones in and try and distract myself from where I actually am.
Do you think that that is a feature of anxiety, or do you think that that's like straight up medical PTSD?
Medical PTSD.
I was gonna say I honestly don't know because I wouldn't, you know, be able to tell the difference. I'm not anywhere in that field, but it's becoming worse and worse as time goes on, I guess. And then I again put it on the back burner. I don't want to deal with it because the days I do have energy, I want to do things that I enjoy, not, you know, things that are basically going to take me down the rabbit hole.
Shawn, do you experience both depression and anxiety?
Yeah, I definitely experienced both. I think for anxiety, I actually started experiencing anxiety before I could really put a name on it, because I remember like just as a child, like experiencing certain things where like basically a full-blown panic attack, but you just don't know how to name it or what to call it. So then in my adulthood, now when I experience these things, I'm able to acknowledge it and kind of, I mean, not cure it, but at least I know how to combat it more compared to then. And as far as depression, I think depression, um, it's more like situational, like um how Joe was saying it's off and on, but I wouldn't say that I'm like consistently, it's a consistent battle, not as much as anxiety.
When did you start to notice that one or the other was like becoming a thing in your life?
I recently noticed, because I always knew it, but I recently noticed how bad it was because I went to the hospital, and I never go to the hospital, but it was like maybe early 2019 or mid 2019. And I just thought that I was dying, like, not to be extreme, but I really I felt like I was having a heart attack, and I just could not breathe. And I was like, what is going on? And I could not understand like what was happening. And then afterwards, I'm able to accept the fact that like, hey, you had like, this is anxiety. Like, this is all, I don't even want to say it's all mental, because I feel like that's like even downplaying what I experienced, because it was so mental that it became physical. I don't even know how to explain it, but I think that that's when I realized I started like taking it more seriously, I think.
I think it's really easy to look at anxiety and then when you first start to experience it as like a thing you can push aside. You're like, oh, I was really nervous about that. And it just feel like you can't put the words to it. It's hard to verbalize exactly what it is. And that I think makes it easier to kind of push it aside. But once you start physically feeling the symptoms of anxiety, it becomes much harder to not acknowledge it. It becomes a thing very quickly when you like your heart is racing and you can't breathe and everything feels terrible.
Right. And then it's the whole like battle between, okay, so what should I do now? Because I want to feel better, but I don't want this to impact my gut health and, impact all the work that I've done to get this far with my condition. So it's just, sometimes it's an uphill battle.
I think it's an uphill battle a little bit more than sometimes. And maybe I'm speaking for myself here, but it is one heck of an uphill battle. It's like the uphill battle that doesn't stop.
I agree.
Mary, you mentioned that you had some depression, anxiety, PTSD before IBD, right? And after your IBD diagnosis, like when you were diagnosed, were you in a good point where everything was kind of like under control? And then after diagnosis, like when did you start seeing maybe those things flare up?
After I was diagnosed, I kind of had that moment of relief, like, I was right. Like, I knew something was right. I've been telling you guys for 2 years. Nobody believed me. All my scopes came back, yada, yada, yada. And then I got an abscess and they did a pill capsule and we were like, oh, she has small bowel Crohn's. Like, okay. It was like that relief factor. So I was good for a couple months. I began my blog and then like I got diagnosed with migraines and fibromyalgia and just like everything just started exacerbating everything else. And it declined. I stopped going to see my therapist. I stopped talking about it with other people and it just got shut down. Like, I know we mentioned like trigger warnings. Like, I was suicidal in those moments. I was locked up for an evening in a padded room because things got so nasty. And it was like then that I knew I needed to get the anxiety and the depression and my PTSD and like get it under control. So now I'm on a mood stabilizer and I'm doing all right, I think.
Do you feel like the 2 years building up to that diagnosis, like that couldn't have been good for anxiety, right? That was probably awful.
It was awful. Everybody kept telling me nothing was wrong. Nothing ever showed up. My blood tests would come back fine. Even though I would have bleeding, nothing would ever show anything. And people just looked at me as if I was crazy. And then I moved from Ohio to Kentucky and my care team here wanted to start all over in the process because they needed to see it with their own eyes. And I felt very defeated, just kind of, I was so close to Crohn's disease. This is what it is. And we can start a treatment to being pushed back again. And it was very defeating. Like, I felt just down, like there was nothing I could do. Nobody would believe me. I'm crazy, And then finally my GI here was like, oh, you have small bowel Crohn's. Like, let's get you on this. Like, yay.
And then after that, he was like, and let's get you to see a really great therapist and get you maybe on some treatment, right?
Yeah, I saw a therapist. I stopped seeing them after, but I'm still taking the mood stabilizers. And I vent through my blog, so rather than chew somebody else's ear off.
Well, I know you might not know this about me, but I love stats. Like, I love to be like, well, the science says. And one of the things that the science does say, which is why I was like, oh, after your diagnosis, they were like, we're going to promptly send you to a therapist. I pulled up some stats from a 2017 study that said about 21% of IBD patients in general experience depression, but that number rose to almost 35% when they were flaring. And why I think that's interesting is like, oh, those are high numbers. Like, yeah, that sounds awful. Is compared to other chronic illnesses and other like diseases, it's much higher. Like I pulled up the stats for breast cancer, it was 22%, and for lupus, it's 25%. So it's over 10% higher than other chronic illnesses. And I'm wondering, spoiler alert, I know, but I'm wondering why you guys think that is. Is it the isolating nature? Is it the fact that it's kind of this super embarrassing thing that we're not supposed to talk about? Like, why do you think IBD patients experience anxiety and depression at such a higher rate compared to everybody else?
I think there's a lot of people that don't believe you because you don't look sick. I think there's that. I think kind of what Mary was saying, because as I'm hearing Mary's story, I'm like, why was that so hard to diagnose her with small bowel Crohn's? Why did that take 2 years? That shouldn't have taken 2 years. If anything, that should have taken 4 months. Sorry. Like, I don't think that should have taken that long. And I feel like just we don't feel heard. And that's why we find such camaraderie with each other, is because we understand each other. Because it's also a common theme of like, oh, you don't look sick, or I'm not going to get into this, but I did have a very major side effect from Remicade. And my doctor said, oh, that doesn't happen. But you turn on the TV and Humira will let you know how it's going to kill you in every way possible. But it's like, so now you're making me feel like that didn't happen. And a lot of people can relate to that. And I think the embarrassing nature, I can talk about anuses all day. And wow, but like I was never able to say that word without laughing prior to diagnosis.
I also think, I was talking maybe to you about this, Jackie, but just the difference in how we're diagnosed versus like other conditions. For example, cancer. Like when my grandfather was diagnosed with cancer, it was like a complete, like the whole center was so supportive. And then they sent in therapists. They sent in literally somebody to handle his insurance and somebody to explain chemo and everything. But when you're diagnosed with IBD, it's like you have this good luck.
Well, and I also feel like, hopefully your experience with diagnosis was not the same as mine, but almost everybody I talked to has some horrendous experience with diagnosis. But with I was having a flex seg that I was awake for, and I was in the middle of a flare, and the doctor tapped me on my shoulder and said, don't worry, it's just ulcerative colitis. And so there was this sense of, one, like, how humiliating is it to have like that happen? Like the concept of like, you've never been sick this way and now you're awake while you're having a scope, like everybody, it's awful. But then the doctor kind of belittles you and taps you on the shoulder and says, don't worry, it's just ulcerative colitis. And less than a year later, I had my colon removed. So like, there's also this aspect of, it's humiliating, it's embarrassing, and is this not as big of a deal as it should be? Like, are the doctors downplaying this everywhere, or is it just my awful experience?
Jackie, I had my GI say that to me. My first GI said, don't worry, be glad it's not Crohn's. I was going to the bathroom 50 times a day. I lost so much blood, I had to have blood transfusions, but be glad it's not Crohn's. And I'm not downplaying Crohn's. My boyfriend's got severe Crohn's. I'm not downplaying it at all. But to hear that really hurt, because it was like, oh, you have the lesser. And I understand that ulcerative colitis can be very mild. I do understand that, but I vibe with you, Jackie, because that same exact thing happened to me and it's still in my head.
Well, and one thing that's a struggle too is just coping with people not taking you seriously, right? Like a lot of people think that, inflammatory bowel disease, for starters, it's frustrating because people often associate it with IBS. So they just think that maybe you go to the bathroom a little bit more often and deal with a few cramps here or there, right? But we all know that hiding and bottling your emotions in general is going to cause some problems down the road, right? But when people don't take you seriously or don't understand your disease, or every time you have a little bit of a flare up, they're going, oh God, you're sick again, right? Like, what's going on? And, it's frustrating. And then you get that background anxiety and the stress, which actually makes your symptoms worse and can flare up your disease. And, I remember times going into the hospital and I just know I'm going to have to do convincing when I get there, or if I'm not feeling good at work, or if I have to turn down plans, you know, I feel like I'm trying to convince people that I'm sick. I spend half my time convincing people I'm sick, and then the other half of the time I'm convincing myself that I'm fine, that I need to go out and do shit. And it's just confusing and hard, right? And you know, it's a difficult thing to cope with because it's just so misunderstood. That's what I find anyway.
Half the time convincing other people I'm sick and half the time convincing myself that I'm fine. I feel like that's like we're an hour in and that's like the winning statement for the evening for me because I just relate to that so much. And about a year ago, almost exactly, I went into the hospital. I went into the ER, which we all know we wait too long to go into the ER because it's a terrible experience. So you put it off for like hours or days, realistically. So by the time you're there, you should have already been there. And I was like, I'm pretty sure I have a bowel obstruction. I've never had one before, but like, I'm pretty sure I'm 10 years into this. I'm pretty sure this is it. And I went in there going, I got to convince them that I've got a bowel obstruction, right? What if they look and they can't see it? Or like, what can I say to convince them that I have this? And they did the scan and it came back and they were like, you have a bowel obstruction. And I was so relieved that I didn't have to convince them, that it was just like, oh, cool. We have this thing where you saw it and you believe me. And then instantly it was like, oh, and now I have to be treated for a small bowel obstruction, which is the worst. So the idea of like, before I went in, I was like, I'm fine. I can handle it. I spent 4 hours at home going like heating pad, hot tea. I got this. No problem. Totally fine. And then the minute I decided to go there, I was like, please believe me. And my husband was with me. It was the first time he'd ever come with me. Every time we've experienced anything like this together as a couple. And I was like, I told him there, I hope I hope I don't have to explain this and like get them to believe me. And he was like, why wouldn't they believe you? And I was like, oh, just you wait. And I was wrong. They actually believed me, which is great. But it was that moment of like, remember what it was like when you thought your doctors would just believe you because you said something was wrong?
I was in the ER one time and I was in an extreme amount of pain. I was buckled over and they ended up giving me some intravenous pain meds just while I was waiting. I hadn't even seen a doctor yet. And so I'm sitting there and obviously just like most people, we have a habit of distracting ourselves with our phone, right? So I got the pain meds and then I was kind of looking on my phone and I was scrolling through social media or doing whatever. And a nurse came to get me to go in and see the doctor. And while she was walking by the nurse's station and I was getting up grabbing my stuff, I heard her say to the other nurse, well, he's sitting on his phone, so obviously he's fine. Right. And like, meanwhile, I'm like sitting there totally buckled over 5 minutes earlier, but you just gave me intravenous pain meds. So yeah, I'm doing a little bit better. Right. But even medical professionals don't take you seriously until they see empirical evidence. And sometimes with Crohn's, there isn't empirical evidence. You can have terrible things going on that don't show up in the ultrasound or don't show up, you know, in whatever emergency treatment they can use to look at what's going on with you.
Isn't that the ultimate joke with IBD? Like it's an invisible illness outside, but it's also invisible inside sometimes. And it's like the cruelest joke ever because you know your body. And I don't know. I think that that's another thing with mental health where at some point you do start to question yourself. Not like, am I making this up? But like, is it as bad as I think it is? No, it's like you definitely start to like second guess where you're at. And I think for me, it definitely stems from like the first time a doctor doesn't believe you. And you're like, oh, maybe I don't know what I'm talking about, especially if you're newly diagnosed. Have you all had experiences where doctors didn't believe you?
Yeah.
Yes.
And just recently, actually, because it's, well, or it's the comparisons all the time. Well, it's not as bad as it was before, so I don't understand why this is happening to you. Well, if there's still something, like I'm not making up these symptoms. Trust me, I don't want to be going through this. I don't know why, like you said, I have to like prove this is, to a certain extent, even though it doesn't always show. Or I've actually gone into the emergency room and they've given me an anti-anxiety med and then sent me home and told my doctor I was okay. And it was not. So thankfully I did have someone with me that time, because like I, was like, oh, good, that's not in my head.
Well, and I think something that's important to consider too is people wonder why, if you're wondering why there's mental illness, hitched to chronic illness, especially with IBD, is because a lot of the time isolating is a better option, because I find with myself, I either isolate and I hide my symptoms and I cope with whatever mechanisms I decide to do that with. Because when I get up and when I advocate for myself, even if I get the treatment that I'm looking for, a lot of the time I can get torn down for identifying too heavily with my disease, or attention seeking, or all these different things where you almost can't win, right? You're damned if you do, damned if you don't.
I think the isolate. Yes.
Sorry, I didn't mean to interrupt you. I just, this was just a theme, and I wanted people to know that there has been research done this year. I can get the link to people probably tomorrow, because I'm tired and I'll be tired after this. But I wanted people to know that if you are diagnosed with pediatric Crohn's, this was for Crohn's, not colitis patients. They're just studying pediatric Crohn's. There's a 20% chance that you will have post-traumatic stress disorder. And it's a heavy theme in people's lives, and these themes we're talking about now really heavily play into it. Doctors not believing these symptoms that are just very bizarre, and then now that we have social media, there isn't HIPAA, so now we're able to talk to each other. Okay, so now we're like, okay, maybe we're not all that crazy, because you seem a lot like me and I sure seem a lot like you, but they're sure making me seem like it's all in my head.
I mean, this is a tiny bit of a digression, and I'll be super quick with it, but I have a family member who struggles with post-traumatic stress, and it impacts her life greatly right now. And I see, not so much does she seek validation for the symptoms she experiences and stuff, but what I see from the outside is her being treated differently, because she's coping with things that other people don't understand, right? So she's actually really empathetic with me and my illness, because she kind of knows how it feels to be misunderstood and have people just think you're crazy or whatever, when really they have no idea what's going on or what you're going through, right? And not everybody fits into the cookie cutter.
I don't think that's a digression at all. Actually, like, let's talk about medical PTSD, because that's a thing. I think so. When I was diagnosed in 2009, the medical PTSD, not a thing, at least not a thing anybody was acknowledging as a real thing you could experience. And recently people are starting to talk about this, and we finally put the term, we're allowed to call it PTSD now, right? Like PTSD, we are realizing shows up in a lot of places, not just with veterans anymore. And for me, that was a validating thing that I needed. That was actually one of those things where it was like, thank you. Yes. Like I'm not crazy, right? Like I didn't make this up, that when I walk into a hospital, the way that I feel, or that I hate going, like just checkups. Anytime I'm in a medical place, it's just like this intangible feeling of like, I need to get out of here as soon as I possibly can. And I'm sad for everybody who experiences it, but I'm so glad we're all talking about it now. And I wonder, like, do we think everybody with severe chronic illness, do we think we all have a version of this, or are some people just sort of like trucking along and they're doing fine?
There's a difference between, sorry, go ahead, Joe.
I have an interest, like I never really thought of it this way before as some form of post-traumatic stress, but like I know when I go sit down with my doctor, or when I'm sitting down with my surgeon or my gastroenterologist, I find that I'll play down my symptoms because I don't want to sound like it's a big deal. And even when I play down my symptoms, I still feel like some form of imposter who needs to kind of back up what I'm saying with some sort of evidence, so that whatever professional I'm sitting down with doesn't, my perception is that in their head they think that I'm full of crap, for lack of better terms.
And I think it's important for us to look at, acute stress disorders versus post-traumatic stress disorders, because there are those dissociative features that really come with post-traumatic stress disorder. And what I mean by that is the out-of-body experiences. And why that happens is because whatever happened, it's a flight or fight response, basically, in your brain.
What do you mean
And
by
so,
body? Can you explain that a little bit?
looking down on yourself from the sky is an example. Being able to interact as yourself, but you're not in your body is kind of the big one, people. So you can kind of watch yourself. That's why like dissociative drugs can kind of cause that same effect too. But this is your brain trying to handle the trauma response. So I just want people to understand the difference between those. Is like, because I feel like people just throw PTSD and OCD out so lightly, or you're being bipolar. It's like bipolar is not mood swings. That's not what bipolar is. And people just assume that's what that is throughout the day. So, but with that being said, we all struggle with it, and how we internalize it is different. We're not all going to have PTSD, but we could have that predisposition because of X, Y, and Z, what we're talking about.
Okay.
Mary, what were you going to say?
Oh, I was just going to say that, I have extreme like anxiety, depression, PTSD when it comes to like going to the VA, because I've had them blatantly say, I can't be believed because I'm only a 30-year-old female with like green hair, so I'm completely dismissed. And so I think that's traumatic in itself, because you just, again, somebody else that you're trusting is just putting you down and just dismissing everything that you're trying to tell them just based on what you look like. You don't look sick. You're not their regular type of patient. So they just throw you under the bus and hope the next person can help you. That's all I was going to say.
What about Angela or Shawn? Do you feel like you experience PTSD in any way?
I don't know. I don't know if, kind of like Sarah was saying, I try to be careful with what I claim, because I really don't think that what I go through is I don't think that it's a classification of PTSD. I approach things differently because of what I've been through in the past, but I don't think it's so much PTSD as much as it is I've learned a lesson, and now I take that lesson with me. So like we were talking about how you look, of course I understand when I walk in they're not going to take me seriously, so I approach it a different way. Or like when I am talking to my doctor, like when they don't believe you, you do have to like I know not to come right after work with a face full of makeup, but at the same time I don't consider it PTSD as much as I just consider it like a different approach, because I don't think I'm scarred in any way. I don't think it like hurts me mentally or emotionally. I just think that I've changed my approach.
Yeah, like I don't think that I like doing the same crappy stuff over and over again. So I definitely have feelings that come up when I kind of know what I'm walking into. But I've had a pretty close relationship with PTSD in another person, and like I don't think I can say that I've experienced those extremes that I think can come along with like that actual experience of that.
Having been like, I had like been diagnosed with PTSD for like a non-medical reason, and I can definitely tell the difference. Now, I don't know enough about it to say, oh yeah, this one and this is the other, because I mean, how it manifests could be different, and, because it's totally different situations. But I, definitely have different, well, obviously triggers, but different, like, I guess, symptoms of it, like paralyzing fear, nightmares, things like that. So that it's just more like avoidance and like learning how to try and cope with it with more medical.
switching gears, I want to talk about jobs. So I don't know if you all work or if you work full time, but have you had your mental health affect your relationship at your job, or if you're able to go, or how you interact with coworkers? Has mental health ever had an issue with your job? Mary?
I haven't been really working in the past year other than writing, but prior, I mean, there would be days where, I would be just so down or, down in the dumps that I would have to call in. I wouldn't physically be able to like leave the house or even like leave bed. I'm just, it's exhausting in itself, the fatigue and then just the stress. And so, I mean, it has affected me. I mean, I had to stop working eventually just from everything, just kind of compiling, but I could say that it affected me in the past working.
I am also unable to work and have not been able to hold a job since I was 26. And I also don't want to fight for disability because that's a mental health issue in itself.
Right? Oh, I feel like we could do a whole conversation about that in terms of, people believing you and proving you're sick, and, personal worth and value. All of that is just a tumultuous situation. Angela, are you working right now?
I am not. I've actually been on disability for a few years, and actually I had the opposite. Like, I know a lot of people have like terrible experience with disability and getting it. I'm very fortunate that my GI's office keeps like a ridiculous amount of records, and also just with my comorbid like diseases and things, I actually just had to go for my review so they could, renew it. And the doctor looked at me and said, like, looked at my chart, looked at me and went, I don't even know why they sent you. Like this. And like, so I've actually gotten a lot of kindness from that I very much appreciate, because it is a stressful and like nerve-wracking process, and just waiting is terrible.
Shawn, you've got a new fancy job. How's that going?
I think it's okay right now. In the past, I would say working was, I mean, it was okay because I was lucky enough to have like a company that really supported my condition. So they understood when I had to take time off, and they actually would encourage me to take time off, because I'm definitely that person who, like, I feel like I have something to prove, even though I don't feel like I have something to prove. So I feel like I need to work harder because of my condition than like a normal healthy person over here. So honestly, I mean, I think it's okay right now to be on, but I'm also doing a lot better. So healthy me is okay, but sick me is like a different story.
I have a question, sort of on topic, sort of off topic. This is something that I have talked with my podcast co-host about, and I'm curious to get your take. And that is, as who you are today, you are an IBD patient, and you may or may not experience depression and chronic illness. Do you consider yourself as a person with mental illness?
That is so hard. I don't even know how I would like approach, like if someone asks me like, I mean, I guess it depends on how I was approached, because if someone asked me like, do you struggle with mental health, I'd be like, yes. But then if they were like, oh, do you have a mental illness, I probably wouldn't be so quick to confirm that.
I think we view mental health condition and mental health issue as the same thing.
Yeah.
As two different things. And so it's hard to say I have a mental health issue instead of I occasionally have depression.
So I ask because like on the podcast, I said, I am there representing sort of like chronic illness / depression / anxiety. And my co-host is bipolar. And he very clearly identifies as somebody who has mental illness. And I don't. I also don't identify as somebody who has a disability either. And we've talked about this a lot. And I have clinical depression. I have had suicidal thoughts in the past. I suffer from anxiety, but I don't identify as somebody with a mental illness. And I have a theory, no data to back up my theory, but my theory is as people with chronic illnesses, they tend to be in the forefront. They tend to be more problematic. They tend to be the thing that you are treating more often, at least in my experience. And so I identify more as a chronic illness patient than as somebody with mental illness. It's almost like the secondary thing. So it's not as, people don't believe me as much and I have to work harder to get care for it. So it's interesting because like on paper, I'm sure that I am a mental illness patient on paper, but personally, I don't identify that way.
I think it's the same with disability for me because even though I know I have a qualifying disability, I don't call myself disabled. And I've never actively, like, unless I absolutely had to, I never actively, I mean, I've used accommodations like FMLA and things like that, but I've never, like, unless my ostomy like exploded or something, I would never choose to use like the larger restroom. I would never choose to use the disabled parking unless it was an emergency. So I don't know what it is. I'm just like, and a part of it is like the judgment that comes along with it. And then the other part is just like, I just don't, I always feel like I'm not, like, even though I've been at my worst, I still don't feel like I qualify. Like, I feel like there are so many people who struggle more than me, who deserve it more.
I think that identification with your disease is a fine line to walk, right? Because, you know, I identify with my disease when it comes to getting support or getting treatment or, you know, any type of medical care and the help I need and that sort of stuff. But, and this is just my opinion, so take it with a grain of salt, but I'm really careful with identifying with my disease when I'm out and about in my daily life. You know, simply because it's rarely met with a result that is positive for me, right? It's just not something that you know, I have a permanent disability placard for my car, for instance, right? It was given to me when I had such severe pustular psoriasis on my feet that I couldn't walk. And then my doctor said, we'll leave it permanent so that if you ever are having an emergency where you have to go to the bathroom and there's no parking available, you can park in handicap parking. But I've never used it for that, even for that purpose, because I don't know if this sounds odd or not, but I find the more I identify with my disease and the more I focus on having it, the worse it gets. I don't know how you guys feel about that. I'd love to hear your opinion.
I can understand where you're coming from. I said not that exact thing, but I did say something like that today about how, like I mentioned that I don't feel well. And I was like, well, maybe I don't feel well because I'm like thinking about the fact that I don't feel my best. So maybe I'm feeling worse. And then when I stopped talking about it, I felt like I felt better. So I don't know if it's like the whole, I don't know how to explain this, but yeah. But the weird thing is like I can identify with my condition in public. I don't have a problem with like identifying with having Crohn's, but then if it comes to the disability or disabled talk, I don't.
I mean, I think I identify the most strongly with my disease when I'm talking to other people who have it, right? Because then it makes sense, and then there's empathy, and then there's jokes and laughs because we get it, right? But it's just not helpful for me out and about in my daily life because people are like, huh? Or like, they just don't get it. So what's the point, right? That's just kind of how I feel about it.
Mary, what do you think?
like I get what they're saying. Like when you think about it, you start thinking of like every little symptom, and then it's like, oh, is that another symptom of my disease? Like, am I making this worse on myself? But then again, like I will happily go anywhere and tell everybody what's wrong with me. Lexapro saved my life. Like, I have Crohn's, I got butt problems. Like I have no reservations about sharing it. But I'm kind of like, everybody else. Like I'm not gonna go out and just like I'm a disabled person. Like I've never referred to myself as that. Like. And I don't ever refer to myself as kind of a mentally ill either, but I mean, I have no reservations about telling people, like I have mental health issues. I think it's just, maybe there's more of a stigma on one terminology versus the other, but I think that made sense.
Yeah, it made sense. I just always thought that it was a really kind of interesting thought process because, for instance, like I said, my co-host, he's bipolar. He's very much like, I have a mental illness, end of story. And I was like, oh, I don't think that I do. And he kind of pushed me like, what do you mean? And for me, like I also have multiple sclerosis and I have IBD. And so for me, those two take the forefront most of the time. And even with both of those, I don't consider myself disabled. So I look at it like that is how I look at my illnesses, I guess. And I don't look at them as disabling, at least not yet. And not right now. I mean, I think IBD was pretty disabling at a certain point, but and I look at it as like my depression and anxiety is relatively under control. So I don't see it as an illness right now because it's well maintained.
I
That's really
do
mine.
identify. Oh, sorry, go ahead.
No, go right ahead.
Okay. I personally do identify as disabled. I realize it's different for everyone, and I appreciate both sides of it. And for me, the more I accepted that, because I do have unique things. I need IV fluids every week. I can't really regulate my body temperature. I mean, they aren't necessarily IBD related things, but some of them are. And for me, knowing that I have some unique challenges, it has allowed me to kind of take time with myself and be kinder with myself when I have a 4-day migraine or, my intestines are spasming or whatever it is. But I like to think of myself as a disabled person that can do a lot of things.
The way I view myself kind of depends on the day and how I'm feeling. Because, and I mean, not just with IBD, because I mean, that does change the way I'm feeling in my day. Or like just recently I had low iron and potassium. So like I took my niece and nephew somewhere and they're like running off and I'm like, oh, I'm trying to catch up. But like some days I have something else that one of my other conditions that like I get like really close to like pre-syncope, and I've learned how to manage it so that I don't. But like there was a point in time I could only walk a few steps or have a syncope episode and I'd be on the ground. So depending on how I'm feeling, it kind of changes how I view myself that day.
We are coming close to the end of our session here, but we've got some Q&A, but I have a couple questions that I want to sneak in here really quick at the end. And one of them is, what has been the most successful way that you found for managing or treating your depression or anxiety along with treating your IBD?
Sharing with everybody else and finding people who can relate and just putting it all out there. And even if it helps one person, it's beneficial to me. It's like, okay, one more person can relate to this. Like, I'm not crazy. It's happening. Like, let's figure out, what's going on. I've just found, my blog has helped, sharing with my family, like my twin, like I vent to her like constantly. So it's just having that support system too, I think has been really supportive and like helpful.
Rewind. Do you have a twin?
I do. I have an identical twin. Mindy, she's going to love this shout out. She yelled at me earlier.
Does your twin have IBD?
She does not. She ain't got nothing wrong with her. Nothing.
Well, ain't that some crap?
I know.
Not crap though. It's like actual
yeah.
crap.
Shame on you, Mindy. You gave it all to me.
How's everybody else treating their depression and anxiety?
catharticism, man, if that's even a word. But getting it out, writing, talking to people, just being aware of it, you know, mindfulness, that sort of stuff. I've done a lot of meditation around it, and you know, just acceptance, man. It just is what it is. It's the unfortunate fact about it is, you know, my reality is what it is, and it's my responsibility to seek support and find ways just to be okay with it. And so when I'm feeling down, I try my best to get out there, try not to sit in it for too long, right?
I agree. I like find different ways, and I am an aunt to many, and so I like spending time with the kids because children will say whatever, and they have zero filter, which usually is funny. And just spending time with them will like brighten my mood because they don't know like how to filter themselves and not be inappropriate sometimes. And it just makes me realize like it's like I'm fortunate to have that, and I'm fortunate to have a support system that it works like well. That I know there's certain people I can always count on, and like even people who have the disease or like family members that don't. So,
Shawn, Sara?
I feel like I identify a lot with what Mary said, just talking to other people. Like, I do go out in public and talk. Like, my first day back at work, I told everyone I have a bag. I want to spread awareness around it. And my Instagram is a really big one. My boyfriend has Crohn's, so I get the luxury of that support all the time. And then, you know, just having the family members.
Did we lose her? What about you, Shawn?
Sorry.
Do you want to finish what you were saying?
Yeah, sorry, my internet keeps failing. I apologize. I just wanted to say one thing. It's just family members and friends that really do try to make the effort to learn about IBD and support the best they can. That's how I deal with mine.
And huge shout out to family, man, family and friends. Like, you know, they deserve just as much recognition as anybody for helping our sick asses through the stuff that we have to go through, right?
They get
Shawn,
to know
what do
a
you
lot
do?
of fun stuff about our bodies.
Well, no one else said this, so I'm going to say it, which is I go to therapy all the time because I love it. I think everyone should go to therapy all the time. And also, I take medication. I know that I do much better on medication, and I know that my body has a hard time regulating. I even wear serotonin molecule around my neck because I have such a bad job at making my own. So, I personally like, I know that that's not everybody's choice. I think all you guys are right, but I also wanted just to throw it out there that therapy and medication is something that I rely heavily on to maintain really, really good mental health.
Yeah, I take medication too. I've taken it for years, and it's just part of the daily regimen. I don't remember what it was like to not be on it, so I don't even know if it is working anymore, but I'll keep taking it.
I've tried to come off a few times for all the reasons people try to come off, like, I'm doing great, I don't need this, or I don't want to do this anymore, like all those like bad reasons, and it never goes well. So I basically just committed a couple years ago to I'm gonna do this, and I'm probably gonna do it forever, and I'm okay with that.
Agreed.
Okay, one last question directly for you guys. Has IBD ever impacted your mental health positively?
Ooh, that's a good one. Absolutely, it has. In a huge way, it has, right? I'm not sure. Before my diagnosis, Okay, well, let's go with this. After my diagnosis, that's when my life really began. That's when I started becoming interested in recovery and becoming interested in, accountability and reality, and coming to terms with the way my life was. And my feet came down to the ground, and my life around me started happening in such a way that I saw it all through completely different eyes. Right? I feel better now. Mentally and emotionally than I think I have in my entire life. And I think my chronic illness was the catalyst that started all of those other therapies and things that started in my life, because like self-care became the forefront. And once self-care and treating my disease started becoming a forefront, self-care in so many other ways started becoming a forefront. And I'm grateful for my diagnosis at the end of the day, because I don't know where I'd be without it. I don't even know if I'd be here without it. Right. So that's where I'm at.
I totally agree with it. Like, it forced me to take care of myself and focus on myself and kind of let other things drop away, and drama and like what's important to me. So like recently, because I haven't been feeling well, I actually have been pretty much off of social media, just trying to focus on me and self-care, because it that's the most important, is to get everything kind of as in order as you can.
Mary, what about you?
I would say it's been positive, just because you kind of find out a lot about yourself, how strong, you are. You find, you do your own research, and, you just become this bigger and better person, starting to care about yourself, if that makes sense. I think it was positive, like when I got my diagnosis, to put a name to it, and then to just realize there are ways that I could help myself and be better. You know what I mean?
I do know what you mean. I just did a post on Facebook the other day, basically saying like, who was I before I was chronically ill, and trying to like remember that person that I was. I was diagnosed with MS at 21. I am much older than 21 now. And so it's hard for me to remember, and I was diagnosed with colitis at 24. So trying to really think like, who was I? And I don't think I was that great. Like, I wasn't a terrible person, but I wasn't really like bringing anything to the table. I wasn't doing anything. I didn't feel like I had a purpose. I didn't have any passions. I just was like existing. And I feel like after I got diagnosed with MS, and then again later with colitis, that it like kickstarted me into being a person that like had a life worth living, I guess. Like I had a purpose, and I had a passion, and I met great people, and I wanted to live more. Like my life mattered a lot more to me once I almost didn't have it.
Yeah, I agree with that. Like even just helping somebody else, it's just like, it's positive, and like you don't realize how strong you are until you have this happen, and then you're like, I need to get my voice out there. I have a perspective, I have a voice. I'm going to share it with others. So I think that's positive in itself.
Anybody else? If not, I'm going to start hitting you with questions from the comments. Okay.
Great.
So we have a couple questions from the comments, and thank you to the people who sent those along. One of the questions is, I'll start right at the top, was, does anybody have PTSD as a result of having an accident in public?
Yeah. So, okay, normally I wouldn't say anything, but yeah.
But I'll just share it with my close friends on the internet.
Exactly. That's family, it's fine. Yeah, and like, so like I said, I still don't say necessarily that I have PTSD, but I do have those experiences where it's like reliving the past, or yeah. I think it's better now, because now I'm like more confident in my body. But before I went through the J pouch, even the ostomy stage, then like that was literally my life. Was like every day I would wake up in worry and fear.
I still can't go to a Salvation Army. Just cannot.
Sounds like there's a story there.
Had an accident and I sat in the bathroom crying forever. I was so stressed out and just worst experience of my life the first time it happened. And it was, my sister got to hear all about it, and so did all my friends on the internet. So you get over it, but yeah, it's definitely stress.
Yeah, I only really, I think I had like one accident in like public, and it was at a professional baseball game. It was at a Tigers game. And so it was in those like public bathrooms, and I had my ostomy at the time, and I was trying to empty it into the toilet without like getting it everywhere. And then I promptly just got it everywhere. I basically spilled it all over myself. And that was full blown, like you probably relate, where you're in there and you're like, oh God, what do I do? Okay, what's my plan? What's my backup? How can I fix this? Can I cover it? What am I wearing? What can I remove? Like you go through the whole, and the solution is literally nothing. Like there's no good solution. It's terrible. I don't know that I have necessarily PTSD from that. I think I can laugh about it now. But I definitely have a couple situations like that where it's not a fond memory. I'm not excited that I can remember it, but it definitely like puts things in perspective now, where I can go for 8 hours without needing a bathroom. And I appreciate that a lot more now than I definitely ever did before.
I do not have PTSD, but it was the biggest factor in me having a permanent ostomy and not even trying the J pouch.
Okay, another question. Does everyone have multiple conditions, or do you just have IBD?
I have a few things. I have ulcerative colitis, and I also have a form of dysautonomia.
I have Crohn's, and I have several forms of dysautonomia, along with other things.
Yeah, I have Crohn's disease, and then I get a lot of joint issues and inflammation in my skin, as well as psoriasis. Like I get costochondritis in my chest really bad. That's usually the first sign of a flare coming, is when I can't take a deep breath or sleep on my side, or scratch my head without being in severe pain. So yeah, there's definitely more than one thing going on. I think it's rare for usually just for the one thing to be going on. It seems to come in threes or fives.
They're like Pokemon. You got to catch them all. Chronic illnesses. Chronic illness all-stars.
Yeah,
I'd like to know the stat on that. How many people with one have more than one?
Mary?
Oh, I didn't want to get up and cut off anybody, but yeah, I have Crohn's, perianal disease, and then fibromyalgia with chronic migraines. And so I don't think you can just get one. Or after I got my one, I was anticipating, something else to go wrong.
Shawn, are you hanging strong with Crohn's?
Crohn's, I have eczema and then joint issues, and asthma.
Well, don't just asthma. Like asthma's a big deal too.
Well, no, because he never told me. He just was like, hey, you have to take this inhaler every day before you do work too hard or anything. So I'm like, well, I don't know what I have, but
I think it's interesting that most of us do develop more than one condition, because I don't know what it was like for you, but when I was diagnosed with MS, I was like, my life is over. I didn't know anybody. I thought it was like immediately I was going to have to go broke, quit my job, and like sell my house. And I just bankruptcy. I pictured all these awful things. Like nothing could get worse than this one chronic illness. And then 3 years later, there were 2 chronic illnesses and one that was like trying to kill me immediately. So I don't know if it's just really good perspective to have multiples. Like maybe it's a gift, right? You're like, let's check that one that you thought was really bad. But I definitely know that I thought about it differently when I had 2 versus when I had 1.
I felt the same way. And then when they just kept adding on after a while, I was just like, yeah, sure, throw that on the list. Why not? Like, it's just, adding to the pile. And thankfully, like you set up a good team and hopefully they have good communication and, you help facilitate that communication. And it's just like, after a while, it's like, yeah, okay, roll with the punches.
Yeah, agreed.
It's like when you meet a new doctor and they're like, do you have any pre-existing health conditions? And I'm like, how much time do you have? Do you want the abridged version or do you want the Cliff's Notes version?
When I had to switch insurances, they check to see if your medications are covered. I actually had the woman on the phone say, yeah, we're not going to go through any more right now. Like, you can look this up online.
We have a couple more questions to get through. What is the best thing you've done for your mental health since getting diagnosed? Which is a great question.
Got sober. Hands down.
How long after you were diagnosed did you get sober?
Almost a full year. So there was a year of really, thinking that I accepted that I had a chronic illness, but not accepting that I had a chronic illness. Like a lot of kind of, I don't know, I guess delusion would probably be a good word for it. And so just disregarding my health entirely, right? And then it took, I think it was about 7 months actually, and then finally enough was enough.
So it was like a conscious choice to get sober.
Well, yeah, it was, I mean, my life circumstances and me wanting them to get better kind of what started that whole thing. But I don't know, I think there's a certain amount of divine intervention at play as well, but that's for another conversation.
You guys, we got so many other conversations to have. What about
One of the best things,
whoever talked, you talk.
Sorry. One of the best things that happened to me was actually it's counter to what I said, but finding social media, and then I found people who got it. And like, I found Girls with Guts, like you started, and I found Shawn, who, and like all these other amazing people who just knew and understood and like were so kind and patient with me knowing nothing most of the time. So, and teaching me that my voice did matter.
Sarah, what's the best thing you've done for your mental health?
I think just accepting myself. I've grown up just with poor self-esteem, not for real any reason. I just never really liked myself much, whether it was the way I looked, and I just like myself now, which is funny because I have a permanent ostomy bag attached to me, but I really like myself now. And I don't know, there's a few factors in that, but yeah.
Shawn?
I think like mine is kind of tied the same with Angela's, because like when I started sharing my story online, it was helpful. But when I actually formed those like real relationships with people and like made my real like IBD friends, as opposed to like just helping people is great, and like having people read and like understand where you're coming from is great, but you still need someone to support you just as much as you're supporting them. So when I formed those real relationships, I think that that's when I started to feel like I could breathe. Like even going through half of the things I went through, like when I was diagnosed, when my diagnosis changed to Crohn's, they were the first ones that knew. And when I had my ostomy, and I'm like in the like literally the middle of the night crying my eyes out, and they're the ones that are helping me. So I think that that's the best thing by far that I've done.
Mary.
Don't think I could say anything better than Shawn did. Like everyone else has said, just finding those people who can help you through it, who can understand, and just sharing, your perspective. It's all beneficial just to get it out there, and you're not alone.
I agree. I think, it's 2020. There is no reason to tackle this stuff on your own anymore. When I, back in my day, it was a lot harder to find people. I mean, the internet still existed, but it just wasn't like this. Nobody believes me when I say I was one of like 3 people talking about J pouches on the internet at the time. That's how old I am, but I swear it's true. And, there were so many people I've met. I've met so many people who are 50 and say, I don't know anybody else with IBD. I've had it for 30 years and I don't know a single person. And the best thing that I ever did for myself was to meet people, like really know other people. I did that at Camp Oasis, the camp for kids with Crohn's and colitis, where I had been writing in my blog for almost a year. And, like Shawn said, helping everybody, really talking to myself, but I think it was helping people. But I didn't realize how much help I needed until I met people in person, and those in-person relationships, or even like, video chat, like people you can really talk to who become your friends and your family. To me, that was life altering. That changed everything when I found people who could really understand.
Yeah, it's crazy what can happen when community comes together. That's for sure.
Well, and I truly wonder, like, this feels like such a millennial question, but like, what was it like before the internet? I mean, I know there were in-person support groups and things, but the fact that this disease is so isolating by the nature of it, when you are isolated and you can't leave the house, and then let's say the only support group is an hour away, like how much more isolating it must have felt 20, 30 years ago.
Yeah, for sure. I don't think anybody talked about it. Most people, I think, just hid and bottled and coped alone, right? It's pretty sad, actually.
I agree. You guys, we've been talking for almost 2 hours, which is so awesome because I feel like I have so many more questions for you. But also, it's really awesome because, one, it goes to show that if you meet people in real life, you can have these conversations without effort. Granted, I was asking you questions, but how many times have you met up with people in your life and you just talk, you just go, and there's no awkwardness, there's no silence. You just sort of like, your kindred spirits based on your butt diseases. And I think that that's a beautiful thing. So we're going to wrap this up really quick with a thank you for staying up late with us. Thank you to all of you, our advocates, for staying up late with us. Thank you for Gali Health for hosting this. And we have 7 minutes left. And in those 7 minutes, I would like each of you to just give us like one really great tip for managing your mental health on the spot. And it can't be anything we already talked about. It can't be like, go meet people. It has to be like something you can do. You're all looking at me like, great, thanks for putting us on the spot. But it can be something like journal, meditate, any of those kinds of things. Like, what do you do when you're having a bad day? And it can even be sit in bed and watch Netflix. Shawn, go.
Oh no. Let's see. For your mental health, if you're healthy enough, that side of things, go do something that you've never done before, without your phone, without your laptop, without everything. Go do something that you've never done before, but you always wanted to do. And if you're not healthy enough, just unplug from everything, without your phone, without your laptop, without everything, and just chill.
But if you don't take pictures, does it mean that it happened?
Yes.
Mary, go.
Ooh, I would say for your mental health, know that it's okay to complain. It's okay to have a bad day. Like, there's a quote I really like. It's healing is not linear. So know that it's okay to have a vent day and go crazy and have at it, but just kind of let it go.
Joe.
Yeah, I agree. Just, letting myself lose my shit sometimes certainly helps. And I don't know, what I try to do is just not beat myself up for doing whatever it is I want to do, whether that's, have a nap or do nothing or shove off the plans for the day or sit down and play video games for, um, an unreasonable amount of time, and just be okay with the fact that I need to just do what I need to do to get through, um, whatever I'm going through, just to come out on the other side and go, okay, you know what? I gave myself that space to do whatever the hell I want. Now it's time to get back to my life and resume as usual. I'm not
Angela?
creative on the spot.
Hey, I think it was beautiful.
Thank you for the validation.
Angela, what do you got?
Shawn stole mine. Okay, I totally would just say, like, I don't feel selfish. Take that time for you, whatever it is that just makes you feel better that day. Whether it's unplugging or watching Netflix or like I think guilt happens a lot, and don't feel guilty. You need that time for yourself to take what you need to do. And I say this not always doing it myself, so I know it's easier said than done.
Sarah, bring us home.
I really like what Angela said. Like, I really heavily resonated with that, but I'm going to keep it simple and just hang out with your dog. That is the best piece of advice.
Brilliant.
That's a good one. What if you have more than one dog? How do you pick the dog that you stay with?
It's a good question. I only have one.
Pick all of them.
Okay, you guys, this was awesome. I think you're all wonderful. And like I mentioned in the beginning of the call, I haven't met a couple of you previously, and I'm so glad that I got to hear you guys share your stories. And I think that by us doing this, by talking about it, by making it normal, by sharing what's happening, and even admitting to some of the like really unfun parts of living with IBD and depression and anxiety, we're just making it easier for other people. I mean, we know this, is why we're advocates, right? Like, if one, it feels good to know you've helped somebody else, but it also feels good to know that the thing that you needed is out there now. That's what I always tell people, that like, I do this because I need someone like me to tell me it was going to be okay. And I think that we're doing that now. And the content that everybody's creating, especially now, is like setting future generations up for like really wonderful, supportive environments. And I'm really excited about it. And I'm really grateful that you're all so willing to share your stories with us tonight.